Okay, let's look at the next one. Cut out alcohol. Alcohol does a lot of different things, but one of the things alcohol does is it suppresses the immune system, but it also depletes B vitamins and it causes dehydration. These are all things that will work against you, right, as we come into cold and flu season. And if you want to be robust and resilient, you know, you definitely want to minimize your consumption of alcohol. Now, I'm not saying you can't have an occasional drink. I'm not trying to kind of wreck your holiday plans either, because I can just hear you all screaming at me now. Dr. Osborne is just so stoic and he doesn't want anybody to enjoy life. It's not what I'm saying. It's the consistent use of alcohol. And I would look at this two different ways. So alcohol, it's either heavy drinking in an acute setting. So like the weekend where you just get hammered, or the night out where you just heavily drink several drinks, right? So that's one aspect that will really deplete your immunity. And the other is chronic light drinking. Now I get this a lot. How much is enough, or how much is too much? You know, somebody came in just a couple weeks ago to see me. Like, I only have 2 glasses of wine every night at dinner. And in their mind, it was, I only have 2 glasses of wine. In my mind, it was like, holy cow, you have 2 glasses of wine every night. You're drinking 14 drinks a week. You're getting, basically, that alcohol is poisoning you slowly. It's a chronic poisoning. And so you want to avoid that. My advice on any kind of alcoholic drinking is intermittent use. If you're going to do it intermittently. Give your body long periods of time away from alcohol so that it can recover. So use it intermittently. I definitely wouldn't go more than once a week. You know, as just a general rule of thumb, if you're trying to keep your immune system strong, and that one time a week should just be very, very moderate. You know, 1, maybe 2 drinks at the most, and then go a long distance in between. I mean, we know how alcohol affects the immune system. You can see here, this was published in alcohol research, but clinicians have long observed an association between excessive alcohol consumption and adverse immune-related health effects such as susceptibility to pneumonia, which is, you know, again, upper respiratory problem. So in recent decades, this association has been expanded to a greater likelihood of acute respiratory stress, ARDS, sepsis, alcoholic liver disease, and certain cancers, a higher incidence of postoperative complications. What does that mean? That means if you're scheduled for surgery, if you're drinking a lot, if you're drinking consistently and you go in for surgery, you won't heal, right? You'll struggle to heal, and then your body's got to deal with that physical trauma, because that's what surgery is. It's scheduled physical trauma. So it's very, very difficult to heal when you're consistently consuming alcohol. And you can see a higher incidence of post-operative complications. So that's why. The complication is when you're not healing. And so that when you're not healing, that wound can get infected. You can get swelling around the area. If the wound isn't healing, then the tissue or the organ that was operated on doesn't regain its function. And so that comes with different complications as well. And you can see here, in slower and less complete recovery from infection and physical trauma, including poor wound healing. So this also includes your exercise. So this is where consistent daily alcohol will affect your exercise and your ability to recover after your workout and your routine. So if you're drinking 2 glasses of wine every night and then trying to go work out the next day, you're going to struggle to recover from the exercise that you're doing as well, not just because not everybody's always scheduled for surgery. Okay, let's move into the next one. So stop eating foods you're sensitive to. So, you know, one of the things that I'm known for is avoidance of grain and gluten, right? So, I mean, no grain, no pain, for those of you who, don't know. That book has an entire protocol that a person can follow if they suspect gluten sensitivity, and then successfully navigate, that diet. But because this is one of the most common foods that people react to is grain, particularly all grain, not just wheat, not just barley or rye, but also oats and corn and rice and the other grains as well. So stop eating foods you're sensitive to. Now, if you're not sure whether or not you are gluten sensitive, I'd encourage you to do one of two things tonight, right now. One, and we'll put links up in the notes here, but one, get a test. So you could take our quiz. It's a quiz that asks you a series of questions, and depending on how you answer those questions, and we try to guide you in a direction that might be conducive for you to understand that you may be gluten sensitive. So take our gluten quiz. Again, we'll put that link below this video. Or two, get genetic testing done. Genetic testing will give you a confirmation whether or not you have the genetics for gluten sensitivity, and that's something that would help you understand whether or not you need to change your diet in that way. Now, a lot of you watching have known me for a while. Maybe you're already grain-free, gluten-free. In that regard, maybe you're still struggling a little bit. Maybe you're not quite sure why. One of the biggest holdbacks for people that follow No Grain, No Pain is that they have sensitivity to other foods. It's not just gluten that's holding them back. One of the stories I share in my book, No Grain, No Pain, is the young girl Ginger, who not only was she gluten sensitive, but she was reactive to blueberries, and every morning her mom would make her a blueberry smoothie, and she was given a terminal diagnosis. The doctors gave her 6 months to live, and when we took the food away, we took the blueberries away, we took the grain away, she made a full recovery and never died, and she's still alive today, and she's gone on and graduated college. So sensitivities can be a major drawback or holdback to your immune system. So if you're struggling and you're finding yourself with recurring infections, whether it's a urinary or upper respiratory tract infection, or just chronic antibiotic use from different types of infection, you might consider asking your doctor to test you for other food sensitivities. You can also come visit me at Gluten Free Society. We're actually getting ready to offer a food sensitivity test directly to the public, because so many doctors won't do the proper testing. So get tested would be my point there. Outside of that, keep a good food diary, because sometimes you can pick up on foods that your body doesn't agree with. And so I always look at eating as, follow these 3 rules. Rule number 1, you can't get healthy eating food that's not healthy. That's the common sense rule. You know what I'm talking about. Soda's not healthy. Candy's not healthy. You're not going to have stellar health if you're doing those things on the regular. Number 2, if your body rejects the food by giving you symptoms, in essence, if you eat it and you feel bad, listen to your body. It's right. It doesn't want you to eat that food. There's something in it that is irritant or aggravating to your body. And rule number 3, don't eat what you're allergic, sensitive, or intolerant to. That's where testing sometimes can be a lifesaver for people getting tested, because those can be harder to detect. So, okay, let's talk about nutrition support supplements. So this is my last recommendation of supercharging your immune system. And we really saw this list play out well over the disease that shall not be named, right? We really saw this list, specifically this list of nutrients work extremely well for people, who came down sick. And so, vitamin C increases natural killer cell activity. It's a primary fuel source for immune cells. And so that's one of the reasons why it's so impactful and so effective as an immune supportive supplement. Zinc inhibits viral replication, and it does so in multiple ways. It's actually one of the few substances known to man that can inhibit viral replication in so many different ways. And so many people are zinc deficient. As a matter of fact, look down at your fingernails and your beds of your fingernails right now. If you've got big white spots on them, there's a very good likelihood that you may be low in zinc. And alcohol is one of the things that causes zinc deficiency. So again, just another reason why you want to look at your alcohol consumption potentially too. But zinc, very, very important. I know what the next question is. You guys are going to be like, well, how much to take, right? We're going to put another link below this video for you. And this is the immune protocol that I've been using in my practice for 21 years with people, and we're just going to put that in there, and you can download it, you can check that out and do with it what you will. But quercetin is another one. Quercetin is one of the things that I really like about quercetin is it's an ionophore for zinc. So what that means is it helps open up your cell so that zinc can come inside of your cell. So it helps get more zinc into the cell. That's one of the beneficial effects of quercetin. That's why so many doctors, again, were using it during this last couple of years. Quercetin is also anti-inflammatory. It's a bioflavonoid. It has a lot of anti-inflammatory properties, and it works, what I like about it too, is it works synergistically with vitamin C. So when you combine quercetin with vitamin C, what you get is a synergistic impact on inflammation. They work together in an aspect of your cell. It's very, very similar. The mechanism of action is very, very similar to steroids. And so again, a lot of doctors, when people will get an upper respiratory virus, will prescribe a steroid just to kind of keep the inflammation down. That reduces the cytokine storm risk, and it reduces the potential systemic effects and reduces the potential risk for hospitalization. But when you combine vitamin C and you combine quercetin, they really have a synergistic effect on helping to modulate inflammation. The next one is NAC, and NAC, boy, it's one of my favorite too. That's why these are all my favorite as far as immune support. So NAC has been shown to reduce the time of illness. It's also been shown to prevent a recurrence of illness. This is one of my favorite for prevention. So NAC, again, one of my favorite. NAC's also important. It helps your body produce glutathione, which is very, very important for your liver to be able to help, basically cleanse the blood. And then we have vitamin D. Vitamin D, extremely powerful immune regulating nutrient. Vitamin D deficiency is epidemic. It's interesting, during this pandemic, I actually had a mayor from a town up in the Midwest called me. He called my clinic. He said, I want to talk to Dr. Osborne. I saw him on Fox News, and I want to ask him some questions about vitamin D. So this mayor, he calls me up. He says, I really want to do something meaningful for the citizens that are in my town. And I've gotten some money allowances from the federal government in order to do that. And so what we did is we talked about how he could effectively buy vitamin D for his town and distribute that vitamin D, and what kind of a profound impact that would have on the immune systems of the people that lived in his town. And that's exactly what he did. He went on and he bought enough vitamin D for everybody in his town to get high enough doses to correct deficiencies to drive up vitamin D. So again, the epidemic status of vitamin D deficiency, this is one of the most important. And one of the reasons why cold and flu season comes around in the fall is because that's the time when the day shortens as well. And so we have less capacity to generate or make vitamin D. So this is very, very important. And when that vitamin D starts to drop, we become more susceptible to chronic infection. So there you have it, folks. These are my 7 ways to supercharge your immune system as we go into cold and flu season. Hey, if you've got questions that you'd like to ask, make sure you go ahead and put those in the chat box. But I'll see you back here Thursday, 12:30 Central Time, to answer those questions.